The views and opinions expressed by the host and guests of Frontline are their own and do not necessarily reflect those of the American College of Emergency Physicians.
Ryan Stanton here with ACEP Frontline, joined today by a great friend of not only my friend, even outside the podcast, but a great friend with the podcast, with several prior recordings regarding opioids and the geriatric efforts that he is doing with St. Joseph up in New Jersey. But, you know, with this COVID in 2020 and now getting into 2021, there's many stories and many things that have hit us very close. And as a physician, I think we all understand that we have put up barriers. We've got this Teflon coating, theoretically, and these walls that we use to protect ourselves from the things we see. If we were vulnerable, I don't think any of us could do this job for very long. And so you build protective mechanisms, but those also serve as a challenge in terms of dealing with stressful situations and challenges that we face, or in this case, pandemics, especially when those pandemics hit close to home or in our home. And so for today, Dr. Rosenberg reached out, wanted to tell his story. And if you know Dr. Rosenberg, you know that that's kind of his MO. He loves stories. If you've got anything in terms of a mission, a project, or whatever's working, he likes to frame it in a story. That is one of the best things to do. It's the way human nature is built, that we learn and we advance through stories. And so today, we're going to really just pull back the curtain and tear down the walls. And hopefully, by listening and hearing and feeling Dr. Rosenberg's story, which is challenging for him to tell, and probably not as hard to tell as it was to experience everything that he's gone through, but more importantly, a chance for us to understand that we can be human and that we can take down those walls and that we can talk with each other and we can express the things, the challenges that we're facing. And that's a very hard thing to do, especially in a time of isolation and quarantine, but maybe and somehow we reach out. And there's been pages and things on social media that were designed that way that have been sometimes turned astray. But you know, that's one of the most important things we can do as physicians is connect with each other, tell stories, and understand that none of us are in this alone. So without any further pontification, oration, or whatever it may be, I wanted to bring on Dr. Rosenberg and let him just sail off on the story of his experience, not only the challenges as the president of the American College of Emergency Physicians, but understanding that he is a human being physician that has been under a fair amount of challenges. So Dr. Rosenberg, thank you for joining us.
Thanks, Ryan. As I thought through this and this opportunity to get together and to talk to everybody, I thought about some of our initiatives at ACEP. And part of our initiatives were to really focus on physician well-being. Another initiative was to really focus on current and future pandemics, and also to really look at health disparities and health equity. So this story is called The COVID Cafe. And it requires me to go back a little bit and disclose some health history and some personal stories that are important to frame what I'm about to tell you. I have had lymphoma and have been fighting lymphoma for 4 years. As a result, I have been taking lots of chemotherapy, and the chemotherapy affects the lymphocytes and makes them less likely to identify viruses like COVID. Early on, when the pandemic started in March, one of my colleagues and friends I admitted to the intensive care unit as the first physician in New Jersey with COVID. I spoke to my oncologist and he said, you need to get out of there because if you get COVID, the likelihood of you surviving will not be good. And I stayed out of the clinical area as much as I could, but still managed the emergency department, but remained safe. I wore my PPE and came in. I made rounds and didn't have direct patient contact. But nonetheless, the disease got bad. And on December 8th, I tested positive for COVID-19. I was scared. I was already warned not to get it. But how do you avoid it? How do you know where you even got it? Immediately, in talking to my oncologist and immunologist who was helping out in the case, I had the opportunity to go and get some monoclonal antibodies immediately. And I did. And I was pretty well assured that the virus that is in my body will no longer cause more damage because of the monoclonal antibodies, and I would do okay. Times continued, started developing fever, ended up with multilobar pneumonia, and continued some hospitalizations, some IV antibiotics. And we all know people who have been through this. But this is my story. Nonetheless, I continued to get worse. And the decision was made that I needed to go through a protocol that was the lymphoma COVID rescue protocol, an experimental approach to managing people with lymphoma who have burnt out their lymphocytes and now are dealing with a disease that their body's not recognizing. And it was December 30th, 102.4 fever. I was told to go to a local hospital, which I'm very familiar with, and had been there for my chemo. And I would be admitted to the COVID cafe. They told me I would go to C14. I had no idea what that was. To wait in my car, call a special number. Somebody would come and pick me up, take me through some back elevators, and bring me up to C14. When I got up there, there were rooms as far as the eye can see. In my C suite, there were 14 beds, and I was number 14. I was by the corner, by the window, and there was about 3 feet from my bed to the window. I had a nightstand and a pulse oximeter. To my right was a curtain, and I reached to touch the curtain, and a hand touched mine. That's how close the beds were. He said to me, "Hi, friend. Welcome to the COVID ghetto." He spoke with a kind of Eastern European voice and made me chuckle a little bit. Never met him. And I looked down at my feet, and 8 feet away was another person. And I got out of bed and I looked, and the hallway was packed with beds. So here I am in the COVID ghetto. Nurse comes in and tells me, along with the doctor, "We will get you out of here tonight. You're only in this area long enough to get your plasma infusion." And I was a little relieved. couldn't use the phone because people were right next to me. My temperature spiked a little bit more. The infusion started. And eventually I felt a little bit better as the infusion went in. The guy next to me, who eventually I called him Jerry in my own mind, but never met him. He said, you know what happens to people who are here? Every once in a while you see somebody leave and they go to the concentration camp. Not long after that, one of my roommates gets wheeled out, and I'm assuming that means he went to the critical care area, maybe got intubated. I didn't really care. I really just wanted to get out of there. My temp started to come down, but I got a call from one of the physicians leading my team and said, you can't leave. We think you're having some type of immune response and we need to monitor you very closely. You need to stay. You need to stay here. I refused. Look, I am president of ACEP. I am chairman of emergency medicine. I am not staying in this place. I called my oncologist and I said, I'm not staying here. I absolutely refuse. This is absolutely terrible. How can anybody be here? And he said to me, Mark, don't worry. I will get you a VIP room, private room on the VIP floor. You are important. The infusion finished. Nobody came to discharge me. Another person left the area. Jerry said he went to the concentration camp. I'm waiting for the nurse to discharge me. And by the way, this was so terrible in my experience. I didn't take off my clothes because of the fever and I had chills. I kept my coat and my hat on, sometimes my gloves. Couldn't really get as much water as I wanted to drink. But I'm leaving. It's all right. Now I'm going to go to the VIP floor. Nobody came. I said to the nurse, when am I going to my room? She said, this is your room. You're spending the next few days here. Called up my oncologist again because, of course, I have a cell phone. I'm not staying. He said, you have to stay. You can't leave. It's not safe to leave. I got you another room. You'll move shortly. The night goes on, and another person gets wheeled out. I just want to leave. Next to me, there is no shade on the window, but there's a bright spotlight that's shining right on me, and I pull my beanie over my eyes just to cover them a little bit. Hours go by, and the nurse comes to my room. And she says, I am sorry, I didn't tell you, but your room's been ready for hours. I just didn't know you had an order. And we can now move you out of this area to your VIP room. Are you ready to go? I put my hand against the curtain, and Jerry touches me again. And I decided I wanted to stay. Because I don't care that I'm president of ACEP. I don't care that I'm chairman of emergency medicine. I'm with a lot of other people who are suffering from COVID, and they are my roommates. They are my team. And I'm here for a reason. I don't know why, but I'm staying. The night went by, and I couldn't wait to leave. My temperature had come down. My repeat labs were safe. And I was assured that the plasma will help me recover. And they said I could take a walk to the bathroom. There was 3 toilets. Each one had a sink in the room, but no other place to get washed. And I came back and I saw the feet of all my roommates as I went back to my room by the window. And they said I can leave now. And they brought over a wheelchair and they wheel me out. And I can't wait to get to the elevator. And as I'm doing it, in slow motion, my mind's thinking about everything. And I thought that maybe it was one of the best experiences of my life. And what did I learn from it? So I went back to say goodbye to Jerry, who I never met, and he wasn't there. And I want to relate this to ACEP. I learned a lot about myself, about medicine, about people, about caregivers, but more importantly about me. I take care of people every day in the emergency department, and they're all people. They're all Jerry trying to get by. And the COVID cafe was absolutely horrible. And I know we can make it better. And our emergency departments, sometimes with hours, waits, and everything else that we go through, I believe we can make them better. Not just us, the physicians, but the entire team. I think we have opportunity to get to know Jerry as a person, as I wish I had. But then I look at health disparities. I was able, and I'm glad I didn't, to move to a VIP private room. I'm so glad I stayed, because I would miss the opportunity to see what lots of my patients go through when they come to my emergency department. You see, when I come in my emergency department as a patient, I am a VIP. I get the best room, but that's not real life. So if we look at our goals and objectives about the pandemic, current and future, if we look at health disparities, what's our role? How can we make it better for ourselves, for our patients, for Jerry, and everybody else who is at the COVID cafe and in our emergency departments? We are the emergency physicians. We are the nation's safety net. I don't want to get real preachy. I want to say how great of an opportunity we have to make our experience in our emergency departments good, better, best. Something we're always proud of. It's not just about care, it's about knowing your patients. It was a great experience. I never want to do it again, but it was great. So Ryan, that's the story I wanted to tell. It touched my heart. I hope our listeners can appreciate the fact that we too are vulnerable and we're not necessarily that special. We have an opportunity to really make medicine better. And that's what I hope the story helps tell.
One, I think, just reflecting back, when so many of us come out of residency young, relatively young, healthy, not had the experience, it becomes difficult as we build those walls and we build those protections to relate to the humans that we're taking care of.
Yeah.
And I remember going through med school and through residency, at some point for everybody's education process, they said, imagine yourself as the patient, but more ideally, be the patient or be the family of the patient. I think that's even often more challenging. And, as we get older, I think most of us have been either the patient or family of the patient that has been there. And myself dealing with, parents with health related challenges and things of that nature, seeing the systems and understanding the way that it looks from the other side, and the fear and the questions and the communication and everything that's involved. And it's very different for us on our side because we're busting our butts nonstop to see more patients, to take care of everybody, to disposition, to deal with all the hoops we've got to jump through. And so it's hard to reflect and look on the other side. And, I've had people before, and I think as we were coming on, but right before we started recording, we were talking about, the fact I picked up a shift last night because one of our PAs got diagnosed with COVID. And it was one of the most challenging shifts I've ever done. A lot of admitted patients couldn't get beds, 30 something people in the lobby, which for us is just giant. And, and everybody understand. People ask why I get so upset or so frustrated when the waiting room gets big. I said, because those are people. That is you or I. That is our family. That's our friends. Those are everybody out there who've come to us for help. And if we can't find a way, then we're failing them. We have to figure out how to do it. We can't plan based on convenience and comfort. We have to do everything we can to make it as good as possible. And that's an incredibly difficult challenge. And many times things that we can't control as individual emergency physicians, but as a college, as a profession, as hospital systems, striving to understand the human. And that's what I've always said in meetings that we've had, is that as long as we design the system around the physician-patient relationship or the healthcare professional-patient relationship, then we'll succeed. But when we start thinking about dollars and whatever metric it may be, or whatever token it's going to be, or whatever banner we're going to hang up, that's when things start to go sideways. When you told your story, it makes me, think of Juan Fitz, Dr. Fitz. And he worked closely with me on the communications committee, and he was an emergency physician in Lubbock, Texas. But he was a super great guy. And his greatest fear was catching COVID. And he's got young family relatively. And, he catches COVID, gets really sick. Last communication from him was right before being intubated. Then updates from his family on his condition, and he eventually dies. And, many of us think back to the conversations we had with him early in the pandemic about, his fear of getting COVID. And that's one thing you don't hear much from physicians is, I'm afraid. And I heard you say it too. And it's very personal, very, very, it's very exposed as a physician to say, I'm afraid. And I think that's something, though, that we need to grasp onto, and we need to get a hold of as a profession, to say it's okay to be afraid. It's okay to go into a situation with fear, whether it's about ourselves, our families, our friends, or our patients, to be afraid. As you move forward with all of these things that you did with the removing yourself from the clinical practice, the patient front practice, to everything that you did, to that diagnosis, and you mentioned it a little bit in the story, that moment where it became real, because I imagine as a physician, you already knew, but then it becomes real. The test comes back. Somebody calls you, like they called me on Friday, the day after Thanksgiving, I guess aptly called Black Friday, to say, sorry, but you've got it. You've got COVID. Kind of just expand that moment for you with everything you've been through, everything you've been told from your oncologist, and that moment where you've got symptoms and it lands that this is really happening, not knowing what's going to happen as we move forward.
It's it's so true. It's the diagnosis when you hear the word cancer. It's the diagnosis when you hear the word COVID. you know what's in front of you, sort of, and you know it's a road you would prefer not to take, but you have no other option. And how you take the road, I think, defines to yourself who you are. I do believe that these types of experiences make us the people we are, the doctors we are. You said something about not knowing your patient or not knowing your patient's name. And I always thought it would be wonderful if every shift we could get to know at least one of our patients, their name, a little bit about them, particularly if it's an older person who has a story to tell. But during COVID, when things were really bad, we had patients dying in the department. So one of my docs early on, before this became routine, with an iPad connecting a dying patient to the family and holding their hand as they died with their family on the iPad. And I said to the doc when I observed this, I said, "How did it make you feel?" And his response was very simple and still resonates in my mind. He said, "It made me feel like a doctor." And when I look at physician well-being, I think sometimes we go through the struggles every single day as an emergency physician, and I'm not sure we always feel like the doctor at the end of the day, because we never got to know our patient and we never got to touch them in a way that they're a real person. So maybe as we grow this year, 2021 is going to be an amazing year, but as we grow as a specialty and as individuals, maybe we'll become better doctors because we'll understand our patients differently and better, and our role with them. I think COVID is bringing out the best of emergency medicine, and the best of us as physicians, caregivers, and professionals.
Your story reminded me of one of the biggest things that's hit me in COVID, and that's the sheer separation of a lot of people. Um, you had that with the iPad. I had a 90-something-year-old person who came in from the nursing home, dying of COVID, knew they were going to die. They didn't know they're going to die. They were unconscious at this point, but everybody in the emergency department knew they're going to die. And I called the family, and I think most of us have probably spent more time on the phone the last 10 months than at any point during our careers, not just, the air traffic control of trying to admit patients and transfer patients and do that stuff, but talking with family, talking with friends, talking to connections, trying to get stories, trying to update people about the plan and what's going on and getting more information. And I called the family and they said, we haven't seen them for 9 months. And what's the outcome? We're just waiting for this to be done so we could see them again. And I said, well, they're not going to make it. This is the end. It may be 30 minutes, it may be a day, but this is the end. And clearly they're upset. And then they said, we're in your parking lot. And I was just sitting there, and the nurse was beside me, and his name's Amos, and the charge nurse, Stacy. I said, we need to do something about this. We need to figure this out, because the last time they see their family can't be 9 months ago. And then the next time they see them is at the funeral. And, just the moment of saying, this doesn't make sense, but we're going to wheel the patient outside in their bed into the ambulance bay, let the family say hello, say goodbye from a distance. At least we have some air circulation. At least we have some room. We're not going against the policy of the ER to say you can't have family or visitors in the rooms. And she went out there, and we took them out there. And, just that moment, I just could kind of stood back and let them talk. And, just that last moment. And I think we've forgotten, and the challenge of this, one of the biggest challenges of this pandemic is the separation. One of the most important things that makes us human has been taken away, which is being with others, being with our family. I can't imagine something really more challenging than being in the same city, same place as a family member, not being able to see them. But we understand, and the family understood. They said, we don't want to be too close. We don't want to be exposed. We are high risk ourselves. But for them to be able to have that distance based moment with their family member before they passed away, and they did, um, was huge. And those are the things, as emergency physicians, going outside of our way to understand what's going on, and how do we bring back some of that human, bring back some of that connection, bring back some of that understanding of who we're in front of, and who we're treating, and who we're taking care of, is integral, because we only have so many, and it's a relatively short trip, around this spinning sphere that we're on. And at the same time, all those connections, and not wanting to waste a moment. And I think this is an opportunity for us as a profession to go above and beyond. And I think many physicians out there have. I think many emergency departments and staffs and people have gone above and beyond. Your experience with Jerry, of just that simple contact between that curtain, that connection to say, hey, we're in this together. That we Other people may not understand. There may be people saying this is still fake, but you and I, we know this is we're on this together. And even though we may not know each other deep down, we may not send each other Christmas cards, we can at least support each other through this journey that we're having. Where do you see uh, kind of the wrap up kind of things to say? You're listening right now. You've chosen to listen. It's not an article that we're discussing. It's not a practice changing scientific breakthrough. It is the human element of medicine. Take us home with kind of your thoughts and breakdown of that, of where this moves emergency medicine, and how we grow as a profession from COVID-19.
Um, COVID has accelerated the future for emergency medicine and exposed all the cracks and all the flaws in our system. But we focus a lot on the lack of PPE. We focus a lot on some of the negatives. But what we've done as a profession, what we've done together as emergency physicians and emergency medicine, is something we should never forget in our lifetime. We came together as one to take care of a foe and to take care of our patients. And you had said it, Ryan, there's a lot of great stories out there. Those are the things where we went above and beyond to touch somebody's heart, to touch their soul. That's the stories we need to celebrate. And there's many of them. We all can tell the horror, but we can all tell the magic. Thanks.
And as we move forward, I think all of us see light in 2021. Many of us out there, many listening here, have gotten their vaccines, have started to get their vaccines. Probably one of the greatest moments of COVID happened for me today, when I got the text that my parents, both 76 with other medical conditions, got their first dose of the vaccine. Never thought I'd be as excited for a vaccine as I was for them today. Yeah. And, hopefully as we move forward in 2021, we're going to have better days, eventually back together. We can share our stories, share our experiences, and really, though, most importantly, is figure out next steps to move medicine, to move our careers, to move our profession, to move patient care forward. Somebody messaged me yesterday online and said, what do we learn from the response, from the healthcare response during COVID? I was like, well, we learned a lot about how we weren't ready. We learned a lot about how we responded, and hopefully we learn how to not do a lot of things again and to be ready next time something comes around. And I think that's what we need to do, is understand that it's not just the physical deaths from COVID, it's the morbidities of COVID, it's the challenges of isolation, the disruption of lifestyles, the disruption of the things that we do on a daily basis that bring us wellness and mental health, and trying to figure out ways to fight a pandemic while at the same time, addressing and acknowledging those things that may be disrupted, and learn how to work through them. So I don't know that I've interviewed at some point every president since we've done this podcast of ACEP, president elect and president. I don't know that we've ever had I don't know. I can't even say I don't know. We have definitely not had um, such a frank, open discussion on a personal story, personal life events. And I hope everybody out there who's listening can not only listen but share and then reflect on how we can do things better as we move forward personally, with our families, with our friends, with our patients, with our profession, with our hospitals, and with everything else that we do during COVID. And I'm so happy for everybody that has listened. This is one of the first episodes of 2021. I'm so glad for all of you, the thousands of you that join us each week, and hope that we can continue to bring stories and education and information, and hopefully make the lives of emergency physicians, emergency staff, and our patients better as we move forward. So, Dr. Rosenberg, if folks want to reach out to you, how can they do that?
Probably the best way is through my email, ACEP email, mrosenberg@acep.org. And I am happy to talk to anybody about their stories, about their experiences. And we are amazing. And Ryan, you had said it, so I believe the sun will shine brightly on us in 2021. So get your shades ready, and we'll all be together in Boston and just have a chance to shine on brightly. Thanks, my friend.
I honestly cannot wait to share a little bit of Kentucky's finest, whether that's an ale 8 or whether it's a bourbon, with everybody out there when we can once again get together and tell stories and see each other in the face without a mask hiding our expressions, and getting back to more of normal as we move forward. And, you mentioned the ACEP. I guess I need to, and I hadn't thus far changed the address where people can email me on this program. So for today, we're going to do it. First time on this program. If you want to contact me, it's rstanton@acep.org. rstanton@acep.org. You can still do the youreverydaymedicine@gmail.com if you like to, but it's official. Let's make it official. Follow us along on our Facebook page, and make sure you subscribe to the podcast, and share it with your friends, your family, those around you, whether healthcare or not. We try to have conversations that relate to everybody out there. And so, with that in mind, Dr. Rosenberg, I really appreciate the time. I appreciate the just being open about everything, being willing to tear down those walls and slough the Teflon for us here on the podcast. I mean, it takes a lot to say, not only to tell the story in general about, personal challenges like those that you've faced, but also to do it, when thousands are going to listen to it is even more bold. So, I really appreciate that, and couldn't ask for a better start for 2021, and wish everybody out there a great new year. I hope that you all get a chance to take a deep breath at some point. Just, enjoy the beauty that's around us and the things that are around us, and try to connect with those as best you can. And remember that better days are always ahead. And, as we all get our vaccines, we all start to see hopefully an end to COVID. Just remember what we've been through over the last, at least now 9 months, 10 months, and that we as a profession as physicians and nurses and PAs and NPs and staff and environmental services and supply chain and everybody else, the sacrifices you made to be there for your patients, to be there for those in need, and that will never be repaid. But we all appreciate it, and thank you very much. And thank you for tuning in. I'm Ryan Stanton. This has been some ACEP Frontline.